Hello, my name is Emma and I'm going to present you a case report which is about a 14 years old adolescent with the Gerbode defect. So this case is about a 14 years old adolescent with a Gerbode defect. A Gerbode defect is a cardiac anomaly, which means the heart is not functioning at its best, where the left ventricles communicates with the right atrium. Normally, the heart is divided in 4 compartments, 2 ventricles and 2 atriums, and they communicate always in the same direction, which is very specific. Indeed, the blood arrives from the body to the right atrium, then it's transferred to the right ventricle, and then the right ventricle sends it to the pulmonary circulation. After being oxygenated by the lungs, the blood comes back to the heart by the left atrium. Then it goes to the left ventricle and finally goes back to the whole body. In the Gerbode defect, there is a shunt, which means a communication between the left ventricle and the right atrium. This anomaly is congenital. It is made before birth, and it represents less than 1% of all the different defects that can occur in patients. Even more rarely, it can come after a specific disease like endocarditis, which is an infection of the heart, myocardial infection, when the heart doesn't get enough blood to function properly, or cardiac surgery, when you operate on the heart. So, the objective of this article is to present the case of this 14 years old male adolescent with a cardiac congenital Gerbode defect in heart failure. His symptoms began at 2 months old with acute onset of dyspnea. Dyspnea is a difficulty in breathing and the feeling of not getting enough air, like a shortness of breath. It can be a sign of disease of the lungs or the heart. The fact that the onset was acute means that the symptom came really brutally in the life of the patient. Then there was a progression of the dyspnea that was manifested even at rest. But in the disease, the symptoms does not always express themselves that way. Indeed, it can sometimes be without any symptoms. A transesophageal 2D echo showed the congenital heart disease. A transesophageal 2D echo is an imagery technique to visualize the heart. In fact, you put a probe in the esophagus and a sensor on the torso that will pick up the sound waves. In this case, it showed the heart disease by showing the communication between the wrong compartments, the left ventricle and the right atrium. The consequences of this malformation is that the right ventricle was dilated because of the overload pressure and volume, which means the size of it was bigger than it should. We could also notify a severe pulmonary hypertension. It is a condition where the blood pressure in the lungs is increasing too much. So the adolescent was managed medically for the heart failure and the concomitant pneumoniae. A pneumoniae is an infection of the lungs. He was advised for surgery to correct his defect, and the surgery is the closure of the shunt. So to conclude, we are presented with a case of a male adolescent with a congenital Gerbode defect in heart failure. It is important to remember that patients with this disease may be completely asymptomatic, which means the disease is silent. Sometimes patients may also have heart failure associated to their disease. The transesophageal echo leads to the diagnosis, and the surgical closure of the shunt between the left ventricle and the right atrium is recommended. and close and regular follow-ups should be emphasized. Thank you.